The American Medical Association is out with a new framework for physicians' role in the age of artificial intelligence, insisting doctors remain central to patient care. But our next guest says the evidence disagrees. Joining us now, Dr. Ezekiel Emanuel. He is the Vice Provost for Global Initiatives at the University of Pennsylvania and served as a White House Health Policy Advisor under President Obama. And he's the co-author of a new piece in the Journal of the American Medical Association that asks, will autonomous AI exceed AI-aided physicians as the best medical care? And I think you're creating a little controversy here, Zeke, but I definitely want to hear more. Maybe I start by asking about your brother and Claude and how that makes part of your point.
Yes. Ram.
And which brother?
Yeah, Ram had night sweats for about 2 weeks, and he called me, and I went over possibilities, infection like Lyme disease or babesiosis. I went over, dreadful possibilities like cancer and Hodgkin's disease. He went to his doctor, got 48 blood tests, all negative. Doctor and I, scratched our head and said, well, maybe it's post-viral or something, and, sort of dismissed it. The night sweats went away, and then a few weeks later, he went out to Montana, went fly fishing, and a few days later, the night sweats came back. He went out to dinner with his wife and said, Amy, why don't you look up Montana trout fishing and night sweats? And lo and behold, Claude came up with the fact that there's a protein on trout that gets into your hands when you take them off the hook and throw them back in the water, and that does cause night sweats. So there you have a diagnostic case, which, frankly, flummoxed two doctors. Now, I'm not a trout protein specialist, but it does illustrate an example of what we found when we looked at the literature. Since January 2024, there have been 51 studies looking at AI compared to doctors. And it shows that AI is equal to or better than doctors, albeit mainly in artificial cases of patient actors or chatbots, in getting patient information, making a differential diagnosis. What are the possibilities here, like I did with my brother, ordering tests to narrow down those possibilities, recommending guideline concordant care, the best treatment, and then managing patients with chronic disease like diabetes and high cholesterol and other diseases. That's pretty impressive. And if you look at the history, AI alone becomes better and better. And as it improves, when you put doctors in the loop, the way the AMA wants to do it, they actually introduce more errors. And that was the most surprising thing to us, because the doctor in the loop actually could degrade performance of AI alone, not improve it. Are we ready for AI doctors today? We say no. But that doesn't mean that it's not going to happen in the next few years. Not for everything, but for some important aspects of medicine.
So what do you say to doctors who say, hey, you can't replace the doctor-patient relationship that will always prevail in medicine?
So there are two things I would say. First of all, there are lots of large swaths of this country where we don't have enough doctors, especially primary care doctors, rural areas, urban areas. And in those places, AI is going to be tremendously beneficial to get people care that right now they can't get. So you would be comparing AI to, probably no care or care that might be 100 miles away. And that, I think, it won't take any patients away from a doctor, and it'll boost patient care. That's the first thing. The second thing, and I think this is really important, is, everyone talks about the art of medicine, human connection, empathy. So let me say two things about that. The first is, actually, the data suggests that AI might be more sympathetic and empathetic and supportive than doctors. Google did a study with patient actors, and the patient actors consistently found the Google Gemini better, Google Amy better than actual doctors in terms of empathetic support, eliciting information, having them participate in decision making. And that is a warning sign, I think, that, we don't have a lock. We doctors don't have a lock on empathy. The second point I would say is, for the last 100 years, doctors have been touting the science of medicine, not the art of medicine, and we can offer better cures. And we don't admit patients to medical school based upon the art of medicine or their compassion. We admit them on organic chemistry, physics, calculus, biology, and we don't spend that much time compared to the pathophysiology, anatomy, and microbiology on human connection, support, communication. So we'll have to change our medical school if we really think human connection and compassion and empathy are critical.
So John Heilemann, the doctor, making a case here for AI medicine, but we have seen poll after poll show a remarkable shift on AI in the last year or so, where even some evangelists of it have really backed off. Now, some of that is because of economic cost, the size and expense and sounds of data centers and the like, but also just a growing sort of suspicion. Well, what is AI? What does it really mean? Do you sense here that, these American people ready to have AI be a significant part of their healthcare?
Jonathan, I think, there are two simultaneous things, as this show often talks about how two things can be true at the same time. I occasionally will find myself in a conversation with someone where I'll say something about that we're headed towards an era, not just of AI, but of robotic surgery, which we already have some elements of, but where people will be going into get surgery done by AI powered robots, and people recoil at that notion, just like some people recoil at the notion of self-driving cars until you point out that that they will almost certainly be more precise, more accurate, and less prone to error than humans. You'll be able to build systems that are more precise, more accurate, et cetera, and less prone to failure. So I think people are that in general, people have a knee-jerk reaction against that kind of technological takeover, and it's certainly the case that there are widespread qualms, and I don't think just about the economic costs, but about the notion of this large, enormous kind of epochal change that's sweeping across American society, and people don't really understand it. They don't think there's policies in place to prevent against the harms. The anxiety level that we see in polling and that you see in your everyday life is off the charts. At the same time, everyone types into a chatbot the symptoms that they have when they start to feel ill. They've been doing that. Before that, it was Dr. Google. Now it's Dr. ChatGPT or Dr. Claude. People, as they fear the large scale consequences, are rapidly integrating these technologies into their lives. And I wonder, Zeke, it's clear that the quality of information coming out of AI on the medical front is getting better and better all the time. Inevitably, it's going to get better and better all the time. But I remember 1,000 conversations with 1,000 doctors in the course of my life where they'd say, don't go on Google and ask and put your symptoms in, because you're likely to get as much garbage out of Google as you come and talk to an actual doctor. I don't think you're saying that we're at a place yet where people should start relying on chatbots rather than you and your colleagues to get their medical information, right?
You're 100% correct. On the other hand, I would note three things. The first is, as you point out, people are doing it and doing it regularly. And certainly in the younger cohorts, it's a regular way of assessing medical diagnoses, treatment options, etc. Doctors are doing it. 2/3 of doctors regularly consult something called Open Evidence, which is a LLM for them on diagnosis. About 80% have used LLMs in their patient care. So it's already in the system. Second, I do agree the government and regulation is falling behind, and people are nervous that there are no safeguards. And one of the things we have proposed is we need a licensure recommendation. You don't want to use ChatGPT or Claude out of the box So the best models are actually trained on medical information, have guardrails and harnesses to make sure they don't make mistakes. Like, if you say, well, should I go to the emergency room? And they say, no, stay home and you have a heart attack. That's a real case. And the best systems actually have very good guardrails. And we're going to get better and better. And the last point is, we do have difficulty getting to doctors these days, and there aren't enough primary care doctors and others, and this is going to fill a niche. I think it's going to fill a niche in two places. Again, people, mainly rural areas and urban areas that can't get to a doctor, and the tech-enabled, tech-savvy Silicon Valley who don't like people and really like their computers, they're going to be the early adopters, and we're going to see how it works. But there are hurdles, and a lot of them are regulatory and, frankly, malpractice hurdles that we need to solve, and the government needs to get on that pretty quickly.